just so great. Oh my God, I love your show.
I love it so much.
Oh yeah. Denver's Hot 107.1.
Hey, it's Slim, and we are at the Dishler Laser Institute, and I have the privilege right now of sitting down with Dr. Dishler, who will be doing my laser eye surgery on March 10th. How long have you been doing this?
Forever.
Forever.
Well, you know, I was the first one doing LASIK in Colorado about 15 years ago. We've been in this location for 25 years. I've been, you know, I'm a trained eye surgeon. I do cataracts and other things that as well. But I've been doing LASIK for 15 years. I've personally done over 50,000 of them.
Wow.
And
that's a lot of very happy people.
Yeah, it really is.
It is such a pleasure. I look forward to the surgery. I know I'm in the best hands here in Colorado. And I want to tell everybody, if you would like to have your eyes done, I highly recommend you come here. Come for the consultation. It's a great staff of people here, and I really feel like I am in the safest hands possible. So the Dishler Laser Institute, make sure you check for our next video, which should be me like this, getting my eyes done. Dr. Dishler, thank you so much. Can we take a tour?
Sure. Yeah, let me show you around and you can see what it looks like here. So this is our surgery area. This area here, you can see the ceiling is not a drop ceiling like an office building. And once you are in this area, this is a certified, Colorado State certified surgery center. Not every major type surgery is done either in a hospital operating room or in a surgery center. This is a surgery center that we've dedicated just to doing laser vision correction. So we have two operating suites. This is one that has an Allegretto laser, very modern, fastest laser in the world for doing corrections. We use this for some extreme corrections. And this is our Intralaser, which is our first blade-free laser cutter. This is an updated version of it, and so we have two rooms that can do the entire procedure. We don't use this as much anymore because when I take you in the other room and show you the really cool machine, that's the one that we use most of the time. It's even better, more advanced than this one. But it's good to have this one, if nothing else, for kind of a backup in case we have a hiccup with the other one. This is the Zeiss room here, and this is the Visumax. We have the only one of these in Colorado, and the patient lays on this bed. I can show you how this goes here. So the patient starts out laying on this bed. So it starts out here, and then we move underneath like this, under this laser here. And then this is the one that's used to do the flap. So we treat him under here and with this laser, and this is the one that he can't feel anything, and it takes about 20 seconds an eye.
It's just like being on Star Trek.
We put all the data on these little computer screens here that you know, that tell the laser what to do, and we get it all lined up. I step on the foot pedal down there, and it does its thing, and it doesn't make any noise. I said it only takes a few seconds. And then after that, then the same, you know, beautiful nurse will move him back to the center here, give him some extra numbing drops, and then he'll be moved underneath this laser, which is the vision correction one. And then under here, we'll give him the other treatment. Okay, and that takes, again, about a minute an eye. And then after that, then we sit in this blue chair here, and I sit on this side and take a look through the slit lamp and make sure that everything looks okay, check the eyes out, make sure the surgery all had a perfect result. And then after that, finally, we'll come over and sit in this chair. You get a lot of exercise getting this done.
And take a nap?
And you take a nap, and we give you some drops, and you relax, and this thing sort of reclines back. We have you look at the clock on the wall, and that's it, and it's all done.
And then I celebrate. I will be celebrating, jumping up and down for months. So happy. Like, I'm not wearing my glasses now. I refuse to ever wear them, but I'm about to have my laser surgery, and I'll never have to worry about it again.
Actually, on TV this morning, we were talking about this. There's three fears, actually. One fear is it going to hurt? Because everyone knows their eyes are really, you know, tender, there's a lot of nerve endings, and the answer to that is absolutely doesn't hurt at all. Because we can numb the eyes up with drops that totally make it numb so you can touch it and you won't feel anything. And also, we give everybody some sedation. We give them some happy pills to make them feel comfortable.
Hey,
So
that's something you guys are all very excited about, I'm sure.
yeah. Then the second fear is the fear that I'm going to screw up. I'm going to do something wrong. I'm not going to be able to hold my eyes open. I'm going to look in the wrong spot. And, you know, that fear we take care of also. We have a thing that keeps your eyes open. There's a light that blinks. We just ask you to look at that light. And the eye, there's a tracker that tracks your eye. So if it moves a little bit, it follows your eye. If you move too much, it actually stops and waits till you go back to where you're supposed to be. But that rarely ever happens because usually it's pretty easy to keep looking at that light. That's all you can see. And then the third fear people have is, you know, am I going to be able to see right afterwards? And people are very reassured that right after we're done, the vision's a little foggy, but you'll be able to see a clock across the room and see the time and, you know, see pretty well. And by that evening or the next day, you'll be seeing pretty much back to normal.
I have two final questions for you.
Sure.
How long is the procedure of recovery? How long does that normally take?
Well, the initial recovery is very, very fast. You know, typically people go take a nap, and when they get up, they can see great. They can, you know, we had a patient I just talked to today that said they went out to dinner that night. By the next day, they were out on a bike ride. People drive usually the next day, can drive in here, do most things. But the eye isn't fully healed, actually, for a couple of months. So you have to be a little careful, avoid contact sports, you know, try not to rub your eyes. We give you drops that are an antibiotic. We've never had anybody get an infection, but you know, it's important to put in the antibiotic drops and things like that, and have regular checkups just to be sure things are coming along. The biggest complication, if you will, is that not everyone ends up absolutely perfect, and a small percentage of people need to have it done a second time to kind of fine-tune it, but we've gotten that down to where it's only about 1 out of 100 people, about 1%. So 99 times out of 100, you do it once and you're good to go.
Well, I expect it to go all perfect.
Yeah.
You guys are so great. Oh my god, I love your show.
I love it so much.
Oh yeah. Denver's Hot 1071.